Hello, I'm Mabel Jong. You're watching the World Healthcare Congress Interview Zone. I'm so pleased to have Avik Roy here today. He is a senior fellow at the Manhattan Institute as well as an author of The Apothecary. Avik, it's so great to see you.
Thanks for having me, Mabel.
Well, you certainly get a chance to talk to a lot of people about healthcare. What are some of the opinions and thoughts from people, concerns perhaps, that this is not going as well as people are hoping?
Yeah, I'd say April 2013 is the calm before the storm. We've gotten through the election, and so in a sense the law is going to be implemented, and we're waiting to see what happens with the exchanges. So will the exchanges get set up on time? Will they be online on time? What will happen with health insurance prices? So there's a lot of concern that various regulations in the law will drive up the cost of health insurance, and that potentially could be a big problem.
Well, certainly a lot of companies are out there getting together, collaborating, spending a lot of money on deals that may be quite risky in the end. Do you think these are the right moves?
Well, on the insurance side, it seems so thus far. I mean, if the law stays intact and relatively unchanged, then say a WellPoint, which buys an Amerigroup, because Amerigroup is a big Medicaid specialist, and Medicaid is being significantly expanded under the law. That's the bet that WellPoint made, and thus far it looks like a smart one.
Now, these exchanges that we're talking about, the date is October 1st. We're supposed to see a whole lot of information online about shopping for insurance that's right for you. Do you think there's going to be a lot of passes at this before people get it right?
I think it's going to be very disruptive, particularly in states that have relatively lightly regulated insurance markets. So certain states have very heavily regulated insurance markets, like New York, like Washington State, like Massachusetts. Those kinds of states are probably not going to see as much disruption because they already have a lot of these rating rules that the Affordable Care Act imposes on the entire country. But if you're a less regulated state, like say a Utah or a Texas, that's where you're going to see a big jump, a big hike in the cost of health insurance. And I think that's where there's going to be a lot of concern that the law is going to disrupt a lot of people's arrangements and drive up the cost of health insurance for people who are really struggling to afford it today.
And also talk about payment for outcome versus just fee for services. How do you think people are going to measure what is a good outcome and what is a bad outcome?
Well, we do it all the time in clinical trials, right? So when we study a drug against a placebo, we're studying health outcomes. So we know how to study health outcomes. The problem is we don't really do it in public policy. There isn't that culture of experimenting and trying to look at different populations and see how they do it, and testing policies. We're going to try to do more of that under the new health law. Whether it's going to work or not, I think it'll be incrementally beneficial, but I don't think it's going to make a huge difference, because the real problem is that we're so removed from a system where the customer is in charge, where the patient is in charge, that all these little tinkerings around the edges, they don't really change the fundamental incentives. The hospitals and the insurance companies and the doctors don't have the economic incentives to do what's in the best interest of the patient economically.
Or yet, right?
Yeah, right.
So, and also really measuring what is, how to pay for the outcome.
Right.
I mean, that's still yet to be determined.
Right. I mean, and David Goldhill gave a great talk today about this. In any other sector of the economy, the businesses figure it out because they have such a huge incentive to figure out. David Goldhill put it very simply. He said, if a hospital could charge you only $0 if they killed you by accident, they'd make sure they never killed you by accident. But it's because they can bill you for all these services, even if they do kill you by accident, that they don't really have an incentive to tighten a lot of those procedures that improve health outcomes. So that's the perverse incentives. And I think one thing that we need to realize is that healthcare is not different from other sectors of the economy. Incentives are incentives. Economics is economics, and people respond to incentives regardless of what sector of the economy it is. And if we can introduce more of those traditional economic incentives into the healthcare system, hospitals and doctors and insurers will have much more incentive to care about what the patient needs and what the patient thinks.
Well, we certainly have heard a lot about what is wrong and sick with the system. What do you see as the good news?
Well, I see the good news is that we now have potentially the opportunity through the exchanges to have more people shop for insurance for themselves. Economists on all sides of the spectrum agree that the biggest distortion in our system is people aren't shopping for insurance themselves. They're getting it from their employer, they're getting it from the government. They're not necessarily choosing their own plan. If you choose your own plan, you create some incentives for there to be competition among the insurers to lower prices. Whereas in our current system, they have incentive to have higher prices because they make more money if there are higher prices. So that individual competition that the exchanges might provide, if the exchanges work, could be a good thing. So I think the exchanges need to be reformed to be more market oriented, But even so, I think that's at least somewhat in the right direction, that we're going to have exchanges covering a lot of these people.
And at the end of the day, are we going to be able to fulfill President Obama's vision that everyone will be covered at an affordable price?
Well, I think we're going to get a lot of people covered. The price is going to be a big question mark. So far, prices have gone up, premiums have gone up, and there's a lot of reason to believe they'll continue to go up. And I think that's the biggest concern of this law. And I think for the next 2 years politically, that's going to be the big debate in Washington across the country is this truly affordable care or not? And I think there's reason to be concerned.
Okay, Avik Roy, a real pleasure. Thank you so much for your time.
Thanks very much, Mabel. Nice to see you.
I'm Mabel Jong. Thanks so much for watching.